Microwave treat heart disease. Introduction. Microwave dietary MWT is a form of electromagnetic radiations lying between shortwave and infrared waves, where energy is first absorbed at the surface of the body skin and a part of it penetrates and absorbed in deep tissues. Microwave diathermy doesn't penetrate as deep as shortwave diathermy. Panel diagram of microwave diathermy. Timing circuit, power supply, magnetron, transducer, which has antenna and reflector. At the beginning of 1984, we had the opportunity to discuss the feasibility of utilizing microwave therapy in the treatment of cardiac disease. It was clear to us from the outset that microwave energy might be an excellent source of volume heating, a mechanism that could soften plaque in the coronary arteries and create a biological stent. Such a biological stent could greatly improve result obtained for balloon systems alone. We also trusted that microwave energy could convert electrical active cardiac tissues into inactive cardiac tissues. Thermocouple output thermocouple microwave balloon system. Microwave had never before been applied directly to cardiac tissues. After writing a protocol, they performed initial experiments to study the effect of microwave energy on the heart. A microwave source of 915 MHz and later at 2.4 GHz was connected to a coaxial line terminated by a whip antenna. The antenna was put in contact with the heart muscle of a dog in the open chest model. Figure 1 describes the first microwave ablation procedure in which cardiac muscle was ablated, creating tissue necrosis without producing cardiac arrhythmia. Measurements were then performed in vitro on coronary arteries of both adult New Zealand white rabbits and canine coronary arteries to investigate the feasibility of utilizing a microwave balloon system to enlarge the lumen of an artery and create a biological stent. Figure 2 depicts the microwave balloon catheter system used. A medical procedure for treatment of tachycardia, rapid heartbeat, or cardiac dysrhythmia that used it as a catheter which included a flexible coaxial transmission line coax terminated by an antenna. Figure 1 historical section of dog myocardium following thermal disruption by microwave energy. Reprinted from New Frontier in Medical Device Technology used with permission from Wiley. Figure 2 microwave balloon system. Reprinted from New Frontier in Medical Device Technology. MWD applicators, electrodes. First one, circular shaped applicators, 4 or 6 maximum temperature at periphery. 2. Regular shaped applicators, 4.55 or 521. Maximum temperature at center. Methods of applications. Direct contact applications, less strain radiation, produce a more uniform pattern of heat deep in the tissues. Second one, non-contact applications. Reflection at the air-skin interface occurs frequently, occasionally generating an unacceptably intense X-ray radiation. Physical behavior of MWD. First one, reflections. Second one, refraction. Third one, absorption. Fourth one, penetration. Fifth one, transmission. Thermal mechanism of MWD. Microwaves with frequency of 2450 MHz penetrate 1.7 centimeters in muscle and skin and 11.2 centimeters in fat and bone. Superficial tissues moderately heated achieve a maximum temperature within 5 to 10 minutes, after which local vasodilation prevents further warming. Therapeutic effects of MWT. First one, relief of pain by pain gate mechanism. Second one, reduction of muscle spasm by stimulating of secondary nerve endings. Third one, reduction of inflammation by increasing in blood supply. Fourth one, to promote healing of open skin by increasing in circulation. Fifth one, control the chronic infection by increasing the circulation. Sixth one, fibrosis. Heat increase the extensibility of fibrous tissues such as tendons, joint, capsules and scars. Indication of MWD. Musculoskeletal disorders, spray, stain, muscle and tender tear, degenerative joint disease, joint stiffness in superficial joints, capsular lesions. Second one, superficial inflammation of infective conditions, tenosynovitis, bursitis, synovitis, infected surgical incisions, carbuncles, abscess. Contraindications of MWD: over malignant tissues, over ischemic tissues, moderate and excessive edema, over wet dressing and adhesive tapes, metal implants, pacemaker, overgrowing bone. Hemorrhage, tuberculosis joints, impaired thermal sensation, unreliable patients, recent radiotherapy, hypersensitive to heat, acute infection or inflammation. Venous thrombosis or phlebitis, pregnancy. Heat applied to pelvis or hip in pregnancy may cause hemorrhage or miscarriage. Acute dermatology conditions, severe cardiac condition, blood pressure abnormality. Precautions and danger. The eyes cause cataract. Obesity. With 2450 megahertz of microwave, there is a danger of producing an excessive heat in the subcutaneous fat layer. Dosage of MWD. Duration of treatment 20 minutes is the optimum. Intensity. The patient should feel mild and comfortable warmth. Frequency daily or on alternate days. It was clear to us from the outset to microwave energy might be an excellent source of volume heating, a mechanism that could soften plaque in the coronary artery and create a biological stent. In vitro and in vivo experiments confirmed that microwave energy delivered to specially designed catheters was capable of producing cardiac lesions. Thank you.